Hi everyone, and welcome back to the Guidewell Insights Lounge. This is Kate Warnock coming to you live on location at the AHIP Institute and Expo. We have a very distinguished guest joining us in the lounge, Dr. Patrick Conway. Patrick, welcome to the interview.
Thanks for having me.
Oh, we're happy to have you. So Patrick, of course, is the Deputy Administrator for Innovation and Quality at CMS, and you're also the Chief Medical Officer. All right, so you are going to be addressing the AHIP attendees on the nation's progress with alternative payment models. How are we doing as far as that adoption? Are we destined to always be a fee-for-service nation?
We've made a lot of progress. So if you go back to 2012, we had 0% in alternative payment models. We now have over 30% in Medicare in alternative payment models, and we have 85% plus tied to quality and value. So made significant progress over the last 3 to 4 years, and we think that will continue.
All right, good to hear. So how is CMS working to reduce the social determinants of health, Dr. Conway, and increase health equity across the United States? Especially, how can payers build on that progress?
So a number of different ways. In Medicare, through the Innovation Center, we have a model called Accountable Health Communities. We're partnering with communities to address the social determinants of health. And our Medicaid program, through waivers and other mechanisms, we address things like housing supports, food insecurity, transportation. So we're really working with beneficiaries and their families to address the social determinants of health across the board.
Very good, which of course would then build health equity so that more of the underserved feel part of the health system. Exactly. Terrific. All right, so in your opinion, Dr. Conway, where should payers be focused most as we prepare for the aging of America?
Yes, I'd say a couple things. I now have been in government a few times, so I've worked with 4 secretaries of health, 3 presidents. I just saw one of my former bosses, Secretary Leavitt, talking.
Very good.
He said any organization that delivers better health outcomes at a lower cost will be successful in the healthcare space. I think that's true. I think it's an economic imperative across bipartisan support on the Hill, but even more importantly, across the public and private sector, people understand we have to get more positive health outcomes for our healthcare dollar.
And are you seeing that happening more through collaboration? A payer maybe working with community resources. What's the right way?
We definitely are seeing a lot of collaboration. So I've been at CMS for over 6 years now. We work with all the private payers closely. My next meeting is actually with all the chief medical officers of private health plans. So we work together in new payment models in states and communities across the country. I think that public-private collaboration over the last several years has become very strong, and I think will be even more important in the future.
Very effective too. That's great. Okay, next question for you then. What are the care delivery trends that you're tracking that will benefit those with chronic conditions, and how can we do better for this population?
Yeah, so the biggest thing I'd call out is our use of telehealth and remote monitoring and other technologies. So we're seeing, for example, in our comprehensive primary care model, which is a big primary care medical home model, heading towards 18 states now. Primary care practice using telehealth to manage chronic disease, using remote monitoring technology, really engaging with patients outside of the office visit, so they're really caring for patients where they work, live, and play.
Okay, outstanding. Good to see. So finally, as Deputy Administrator for Innovation and Quality at CMS, how might you use your role to advance the adoption of digital health technologies, AI, VR, even blockchain that could improve patient outcomes?
Yeah, so I think we're trying to do that in a number of ways. One, and we have payment models now where we pay providers similar to how we pay health plans. So we pay them population-based capitated rates, and then we see them innovate with new technologies to deliver better care for patients. I also think we're using what we call our waiver authority, but it basically allows, for example, telehealth waivers, where providers then can use telehealth, store and forward, other technologies to really deliver better care for patients.
Very good. And I can't help but give a shout out to the Office of the ONC. I know that they issue all these challenges, and I think that that's a really innovative, very entrepreneurial approach to taking on some of the bigger innovative opportunities in the healthcare space. So yeah, it's always fun to watch those. All right, so Dr. Patrick Conway, thank you so much for joining us here in the Guidewell Insights Lounge. I know that you have a busy day, so please, you're going to be talking tomorrow, I believe?
Later today.
Later today, all right. Well, great to have you here first. All right, my name is Kate Warnock. Thanks so much for watching.